sit-and-talk therapy is so unnatural for a child. And if something's unnatural and anxiety-provoking, children freeze, just like sometimes adults freeze. You know, children like to do what's fun. This just isn't very much fun for them. And it can cause more anxiety, and it can cause them to have a sort of a bad feeling about therapy. They feel more like it's, I've got a problem, and I've got to go and talk to this person, and I'm different from everybody else. Whereas a child who comes in and is just going to meet with someone who's going to play with them and have fun. And this is the way children can not only express their emotions, but work through their problems. I've found that what happens is the children don't want to leave, and they will ask their parents, when am I going back to see Miss Kathryn? I want, they know when the day is they're supposed to come, and they will bug their parents if they don't bring them. So that's one of the big things about play therapy is the kids are so open to it, and they have even their brothers and sisters, when they talk about what they've done in play therapy, instead of saying, "Oh, Johnny, you have to go to therapy," they say, "Mom, I want to go with Johnny. Can I go? Can I just go for one time?" And so it makes Johnny, instead of feeling stigmatized, it makes Johnny feel special. No, you can't go. I get to do this. You don't. Play therapy is for children ages 3 to 11. And it can be for children with relationship problems, anxiety, ADHD, Asperger's, autism, almost all the behavior problems that children have, especially children who have been traumatized by natural disaster or by the divorce of their parents, separation of parents, children whose parents, one or the other, are in the armed services, or who work all out of town for weeks at a time. Any kind of problem that is not a severe problem, such as schizophrenia. Most of the psychosis, once they get under control with medication on these severe mental health problems, play therapists can certainly help them with ego strengthening and social skills and things like that. There are many different kinds of play therapy. There's directed play therapy, where the play therapist is in charge of the session and has certain exercises or activities that they direct the child to do. And this is beneficial in some cases, but I tend to prefer what is called undirected and indirect play therapy. It's a more child-centered play therapy where the child leads the therapist in the play session. There's quite a lot of research that children will naturally be attracted to the types of toys and activities that they need. There's like an inner sense. Children know instinctively what they need to do with therapy. In indirect therapy, the therapist is constantly thinking at the same time they're playing and trying to read the child metaphorically, and also trying to act as a catalyst for the child to, I would say, evoke from the child expressions of their emotions. Each child is, of course, individual. So I have really made it my mission to study many different kinds of therapy, because no one child is going to benefit from just one type of therapy. Usually it's going to be a combination. So I've studied sand tray therapy, and I've studied something called experiential play therapy, and I've studied art for children therapy, and even pediatric hypnosis, which is sort of more visualization. You teach the child self-hypnosis, which is a combination of sort of a relaxation technique and a way to change their thoughts and change what's going on in their head from negative to more positive. And so the child is really learning to control their mind and the thoughts going on in their mind. And also this indirectly, they learn to control their emotional state and their emotional responses. Play therapy really isn't a therapy that most people are familiar with, and most people say, play therapy, what's that? What do you do? I can play with my child myself, if it's just playing. I mean, why do I have to take it to somebody else to play with? There's plenty of people to play with. To face these problems directly is re-traumatizing, I feel, to children. But when they can use a toy, a costume, any kind of fantasy play to put them one step away from the real problem, then they can release these emotions and feel more in control of themselves than they can if they have to sit down and discuss and be confronted over and over again with these problems. They know what their problems are deep down inside, but it's too uncomfortable for them to go directly to the problem. But indirectly, they can do the same thing using a toy, a skit, even a little rhyme or song they'll come up with. It's really amazing. The play therapy toys are not just chosen at random. We have categories of play therapy toys. There are nurturing toys, such as maybe a doctor's kit could be a nurturing toy, cooking utensils, dishes and plates, baby bottles, and there are aggressive toys. A lot of children have all this anger pent inside, so we have a bot bag, which if you're not familiar with what a bot bag is, it's weighted at the bottom and it's just got full of air, and children can punch the bot bag. Play therapists are always on the lookout for toys that they think that they would feel a purpose and play with. There are also games and cooperative type toys, and there are fantasy. Fantasy is a big thing, and actually they could use all of the toys in any way they want to. They can pretend a fork is a magic wand if they want to. One of the things when a child asks a play therapist, what is this? You say, oh, here in this room it can be anything you want it to be. What do you want it to be? What do you think it is? And then we have costumes, all kinds of costumes, and most children at one time or another go in, and you can't say, would you like to wear the police costume today, or would you like to be a fairy today? Because they'll just say no. They go in and they know exactly what to choose. All different kinds of hats and purses and props for them to use in fantasy. And we have, of course, have a puppet theater and a wide variety of puppets. And many children put on some very intense puppet plays that are pretty easy to read what's what's going on. They might take a female puppet and a male puppet and have them devour each other, or a dragon and a princess. So that's one way they can act out what's worrying them at home without having to say, this is my mommy, and this is my daddy, or this is my brother, and this is my grandfather. But of course, the play therapist is trained to interpret that on a different level. And we have sand tray therapy, we have wet sand, dry sand, and also been trained to read whatever the child is doing, creating in the sand. There's something called sand tray world play, where a child creates his representation of what's going on in his word to use a wide variety of objects, shells and shells of things that are allowed in the sand tray. On occasion, I've had children come to me who have been sent, or parents have been referred to a person who really isn't trained in play therapy. They may have some colors and a few blocks and games, but they basically interrogate the child in a very tactful and kind way, I'm sure. But children don't want to go back, and it can cause more anxiety. So it's quite a complete and involved training to become a registered play therapist. In order to get credentialed and certified, you have to take at least 150 hours of postgraduate. And that's after you get a graduate degree in a mental health field. You have to take 150 hours of educational courses. I got 150 hours of postgraduate training at the university level. And then I actually continued to take even more continuing education because there were specific areas that I felt I wanted more information on. So I did some training in experiential play therapy and pediatric hypnosis, etc. Then also you have to be under supervision. And you're supervised by a registered play therapist supervisor who has at least two years of experience practicing play therapy and has taken additional education to learn to supervise play therapists. And you do 500 hours. Now 500 hours, those sessions last 45 to 50 minutes. So this is comprised of quite a few play therapy sessions. And then you meet with your supervisor for 50 hours. And without going through all the extra education, it would almost be impossible to do this kind of work with children.